Natasha Files, Minister for Health. Is NT News okay there? Yep. Natasha Files, Minister for Health. I'm here to provide an update to the information that was released earlier this morning. There's no changes in terms of that information, but I do have a little bit of detail for Territorians, and particularly out in the regions. We're starting to see those cases right across the Northern Territory. We've been saying for a few days that COVID is in every region of the Territory, and I have some detail to provide people. We have 594 cases of COVID-19 in the Northern Territory through to our testing at 8 p.m. last night, and of that, 172 are those rapid antigen tests. And we have a process online for Territorians. They just head to the website and they can upload that they've had a rapid antigen test that's come back positive as a way of us recording that statistic, and then we can book them in for that PCR test. So I know that there's some availability of RAT tests in some supermarkets and chemists in Darwin, and people have been using those tests, and they're a great tool to give you a quick detection. Is it COVID, or are you just feeling unwell? We have 1,650 active cases of COVID-19 across the Northern Territory, and in the last 24 hours, we had over 3,000 tests. So I thank everybody that has come forward to be tested. We've got testing centres operating right across the weekend throughout the Northern Territory. I'll just provide a little bit of the breakdown of the 594 cases today, where they have come from in terms of whether they're community transmission or close contacts. But people need to understand that this is just an initial grab of information, and then we're doing that detailed contact tracing work as we continue. I've also got a breakdown of the regional data. So 65 cases out of the 594 are presumed to be community transmission. 101 are in close contacts of already known cases. 67 are interstate arrivals into the Territory. 2 cases are from international arrivals, and there's 359 under investigation. Of the cases in terms of close contacts, we've got 835 close contacts in the Territory. 697 of those we've been able to contact, and 288 to date have returned a negative test. Now, remembering these figures fluctuate day to day. The best thing Territorians can do if they get a positive test on a RAT test, or they're informed that their PCR test is positive, is they can reach out to people that they've been in close contact with. So we've got that 4 hours if you spent more than 4 hours with someone to give you an indication. But it is great, even if you've caught up with people briefly, to share with them that you're COVID positive, so they can be more conscious of their health. And if you head to our website, there's actually some draft text messages that you could help to write your message and share with people, family and friends. And we're starting to hear stories right across our community and know of people that have got COVID. And I really applaud anyone that has taken that extra step of letting people know it's what we really need, so that we can all be conscious to our health. I know people are keen to look at the hospitalisation statistics, and again they have come down. We've got 17 people in Northern Territory hospitals. 6 of those people are in Alice Springs Hospital, and 4 of them are in Tennant Creek Hospital, and they're mainly there for surveillance and other underlying health issues. In Royal Darwin Hospital, we've got 7 people being cared for. 3 are adults on the ward, and 2 are on the paediatric ward, and then we have a mother, a carer, that's young one has got COVID, and she also has COVID, I understand, and is a fairly mild illness, but they're both on the paediatric ward as appropriate. We do have 1 Territorian in intensive care, and they are on a ventilator. So that is 6 acute admissions, I'm advised, but I've provided that statistic of 17 people in Territory hospitals. Just turn to the regions. I know that we've been saying COVID is in the regions. It's right across the Territory, and the large majority of the cases, I should say, are in the top end in the Darwin region, but we're starting to see those case numbers build in the regions. In Yulara, we've had no more cases in that reporting period, so we did have a number of cases earlier in the week, so that's pleasing to see. We've got 60 people that have got an address for Central Australia, and we believe the vast majority are in Alice Springs. We do have cases in Yuendumu, and I'll speak to those in just a moment. We've got 4 cases with an address in the Barkly. We've got 8 in the Big Rivers region, 5 in East Arnhem, and as I said, the large majority are in the top end. how we're giving you that information is that's where we're matching the name and the address. So it could be that someone is from the regions, but they may be in Darwin or Alice Springs, for example. So that contact tracing work to clearly identify where they are. But it's showing those cases right across the Northern Territory. We had 3 cases overnight from Yuendumu. I understand these individuals were in Alice Springs and they'd travelled back to Yuendumu or out to Yuendumu. And so we did put up a Facebook post last night because we wanted the people of Yuendumu to be aware. So police and our health workers did a great job, thanks to them. They made sure that those people were aware they were positive. They touched base with close contacts and advised them of their responsibilities. We are concerned Yuendumu does have a low vaccination rate. It's 65% first dose and 41% fully vaccinated based on age over 16, so that is concerning. So we've responded quickly. We've sent additional resources from Alice Springs out to Yuendumu today. Vaccinations are available and we're making sure that there's face masks in that community. But I really encourage people, not just in Yuendumu, but in communities around the Territory, to please be conscious of your personal hygiene. Please wear face masks, use hand sanitizer. Don't share drinks. I know it's tempting in a family situation that if one of the kids is thirsty to give them a water bottle, but this is how COVID spreads. So really be conscious of your personal health and just be extra vigilant. So in Yuendumu, we've sent additional resources. We've also sent resources across to Yuendumu, a nearby community. We have some close contacts there. So we have responded rapidly there, and that's based on that low vaccination rate. So we really encourage people right across the Territory, but particularly in the centre at Yuendumu, there is active cases, and please get vaccinated. We've also got a gentleman in Yuendumu who has returned a positive rat test. This is not in these figures, but we became aware of this morning. We're awaiting some further confirmation. So this case is not included in today's count, but it is important for the people of Yuendumu out there in Nhulunbuy that there is a potential case. So I know that that's on social media, so just wanted to provide some comment on that. Just in terms of our staff in health, they're doing an amazing job right across the Northern Territory. We had hoped that Christmas, New Year, that they could take a moment from the very hectic 20 months that they've had to spend with family and friends. But unfortunately, we've seen COVID make its presence in the Northern Territory, and significantly. So staff are going above and beyond, and I've spoken about the additional cleaning, etc., that they're doing, screening. Just in terms of our staff numbers, I know there's been some questions, so I just provide this. We have around 8,000 full-time equivalents in Northern Territory Health, and of that we've got 120 people as close contacts. That was the figure I spoke to or provided yesterday, I should say, and we've got about 30 people that have got COVID. All but one of those have got it in a social setting away from the health system. There was the one individual in Katherine. So just a little bit of update. Really want to reassure Territorians that we've still got our services available, acknowledge that hard work of our staff, and not just our doctors and nurses, but also those PCAs and cleaners and people that are supporting them. But our healthcare system is there to care for you, whether it's COVID or other illnesses, so please remember that. So just want to remind people to please come forward for testing. Thank that large number, over 3,000 people who've been tested in this reporting period. Our testing facilities are open right across the weekend. We're starting to use an automatic text notification system to notify people when they're positive, and that's got an online registration and a contact tracing form. So we're putting more and more resources on our Secure NT and our Health COVID-19 coronavirus website. So it's worth having a look at that, even if you are feeling well, just to familiarise yourself and prepare yourself if you do come back with a positive COVID notification. It can happen fairly quickly, from starting to feel unwell to getting that test and suddenly realising you're dealing with COVID. And just in closing, before I take any questions, our Chief Health Officer believes that the current measures that are in place territory-wide are appropriate, and there's no additional public health measures. So that mask mandate continues for indoor settings, and also if you can't physically distance outside. And I was at the local football oval this morning, and a large number of people were just wearing masks. So COVID is everywhere, and wearing that mask is really important. So thank you. And the lockout settings will remain in place until Monday at least. So no changes in the public health approach for the Northern Territory. I'm happy to take any questions.
Just for Yuendumu, just how concerning is that low vaccination rate there, and
So presently we've got that lockout, so the unvaccinated residents cannot leave their home unless they are going for one of those essential reasons, but we'll reassess that. Those cases had travelled from Alice Springs, so they're just working through what contact they'd had in the community to date. They arrived in the community and then realised that they were positive, so that was the story there. So our teams are down there making those assessments, but it is concerning to have a low vaccination rate anywhere. A vaccine is safe, effective, and it's a really important tool, and it's your best defence against COVID.
What are the additional resources you've brought into Yuendumu? And you also mentioned the community nearby.
Yes, Yuendumu, yeah.
What's the vaccination rate there, do you know?
I'll have to seek Yuendumu vaccination rate offline. In terms of the additional resources, we've sent health and police, and they activated police last night. I understand that they went into Yuendumu last night to provide that information. So making sure that people were aware that they were close contacts, their obligations, and to stop any potential mixing. So thanks to those health and police and the vaccination team. So we'll make sure there's a surge of resources into Yuendumu.
Do you sense down at Yuendumu there is active resistance to vaccination, or is it some other process that people aren't getting vaccinated?
So we have seen some communities, and there's been a lot of hard work. I was down on the ground in Yuendumu late last year, and there was a wonderful community elder, and she was going around the community and bringing people up to the clinic and explaining how safe and effective the vaccine is. But yes, we have had resistance. It is utter nonsense, the information that is being spread on TikTok and Facebook. You need to make sure that you get your information from a source of truth. So anyone in a remote area, please make sure that you talk to clinic, talk to the health staff. We've got amazing Aboriginal medical organisations, Congress in the centre, that they will let you understand what's in the vaccine. So it is disappointing to see that misinformation spread.
More than 300 cases under investigations, that's quite a large number. Can you just speak to why that is the case?
Yeah, so what we're doing is we're doing a sort of a stop and getting a small amount of information immediately. So that is with a phone call, and we're also looking at automating that through a text message system. So we can just let people know that they're COVID positive. Some people can say, oh, my housemate's just come back from Sydney. That's the most likely source of my COVID. Other people, say myself and no one I've been in contact with has been out of the territory, so it must be community transmission. So some people it's easy to get that initial contact tracing information. For others, it's a far more detailed process. And we also need to remember that people, and this is why I want Territorians to familiarise themselves with COVID and what to do if they do get a positive case. Read information on the NT Health website. There's some good links to some information there from federal government health authorities. But people are in shock, and so our teams don't just simply want to hang up on them. They may spend a significant period of time, like an hour, just talking them through it. So we try and get as much information quickly, but it's not always easy, and so we then go back and do those further contact tracing interviews. So as you see the case numbers rise, you'll see those numbers of source unknown or still under investigation rise.
That 359 under investigation, that was just from the last 24-hour period. What's the total number of investigations?
So I know that yesterday, for example, we provided a breakdown and then they go back through, but it's just too difficult for us to... We're providing the case numbers, the active case numbers, and we certainly are working through cases, but we need to make sure that we're doing the work that's important in terms of testing, working with individuals that are infected, trying to identify sources so we can get those onto the exposure sites and work out any close contact locations. But going back and just simply providing data for the sake of it is not where our focus is.
What was your reaction to the business that was closed yesterday under the CHO directions?
The rules are the rules, and people clearly know them, and we've got so many Territorians, a large majority are doing the right thing, and to blatantly defy those Chief Health Officer directions is incredibly disappointing, and there is penalties in place. And our police, as well as helping manage the COVID situation, are now out there chasing down people that are blatantly doing the wrong thing. So it's incredibly disappointing.
Is it appropriate for the Chief Minister to be naming and shaming that business on Facebook, referring to them as anti-vaxxers?
Well, they are not abiding by the rules. He shared a local news outlet article, and I think it is important for Territorians to know that we've got the large majority that have done the right thing, and then you have a small handful that feel that they're above the law. Thank you very much.
If cases keep rising at this rate, is our health system in danger of collapse? vaccine?
So that was the point that I was making earlier. It's really important for Territorians to know the health system is there and it is there to care for them whether they have COVID or other illness or emergency. So please don't delay medical treatment because you're seeing these case numbers rising. So we have that hospitalisation figure which has come down and so our health authorities have every confidence in our health system that it will care for Territorians over the coming weeks and months.
And what's the, sorry, last couple.
I've been in touch with some residents from the Tiwi Islands that are stuck in Darwin at the moment. They're just getting some mixed messaging from land councils about whether they're allowed to return home. Are you speaking with land councils on this just to provide some more clarity?
Yeah, there has been communication with the land council, so they have been working with us all the way along, and of course they want to protect some of the most vulnerable Territorians in remote communities. So we do need to make sure that people have a pathway home, but we do need to make sure that they're not taking COVID with them. So there has been conversations, I know specifically with the Tiwi Land Council and the Department of Chief Minister around how we can support people to get home but make sure there's no COVID.
And what's the road back for, say, Windsor Territory? If the proprietors, they get vaccinated, can they start their businesses up immediately, or is it more complicated than that?
So in terms of, and I spoke to this yesterday, I know that some people have been really cautious around the vaccination. There's been a lot of mistruths, but if they do suddenly go, you know what, I need to get vaccinated, but they're now worried what might be questioned when they turn up to get vaccinated some months later than the general population. We don't ask those questions. Our health professionals are professional. They simply want you vaccinated. First dose, second dose, booster dose, getting your kids vaccinated. They don't ask questions. They are simply there providing the vaccine. So for anyone that is watching this or listening to this or reads the comments, please just get vaccinated. It's simple, it's effective, and it potentially will save your life or the life of a loved one.
We're hearing reports that COVID hotline has been inundated with calls to the point that it's barely functioning. What's happening there? And is anything being done to improve that?
Yeah, so we've provided additional resources. I mentioned that yesterday. We provided additional resources into the COVID hotline. We've got people redeployed across the NT government. So people have left their nominal role and coming across and helping us with our COVID response. And that's not unusual when we have an emergency, and we are in a public health emergency. But we certainly have heard the concerns that people are waiting online and not getting those callbacks, and we're working on increasing our resources so that can be done in a timely manner. But I also urge people, there's a lot of information online. The CHO directions for close contacts and cases is online, and it's a fairly easy CHO direction to read. Some of them are quite technical, so I encourage people to read that if they've got information about being a close contact or COVID positive. So if you can try and find your information without calling that hotline, that is appreciated. But we've heard the concerns around the length of delay, and we've provided additional resources.
Can I just get some clarity on the positive cases that were detected by RAT? Once they're confirmed by PCRs, does that then go on to tomorrow's case numbers, or how does that work?
No, so we spoke to this earlier in the week when we started providing those RAT figures. We make sure that they're reconciled. So someone will count it as a RAT, and we've been providing that information in our daily update. So the total number of cases, those that were defined by a RAT, and to be defined, the Centre for Disease Control, they need to be positive on that RAT test, symptomatic, or have a close contact that is also infected. But we then do reconcile it. They have that PCR test. They're certainly not double counted.
Is the lockdown still a possibility in Darwin if cases continue to rise at this rate?
I don't think so. I think that you've seen the lockout, so targeting those that are most vulnerable from the from the COVID illness that aren't vaccinated, and the potential to spread that and become unwell. We've seen that with the lockout. So we absolutely can't rule it out, but both the Chief Minister and myself have said we don't foresee that.
Just pop two questions in a way, if I can.
Yeah.
6 days, someone of my acquaintance has waited to get their results back from their PCR test. They still haven't got them back. Is that about typical, and is that acceptable, or is there something you can do about that? And also, what comfort, if any, can you give about the availability of RAT tests commercially going forward?
Yeah, so that first question, 6 days, that's not acceptable, and I really apologise to that person and other people. 48 to 72 hours is the time frame that they should be provided. We need people to know quickly whether they've got COVID or not, and I think they've done the right thing and reached out to get tested. They've isolated themselves, but we do need to be more responsive. So I'm happy to chase up that individual, but I also have been working with health around making sure we're far more responsive. I do hear some of those stories, and whether it's what's gone wrong there. In terms of the rat tests, I do understand that there is a little bit more commercial availability. We have plenty of availability in terms of the people that genuinely need them. We don't just have them for you to take home and pop in the fridge and keep on hand, but we certainly have them available for incoming travellers and out at the centre here in East Arm for Top End and right throughout the territory for that remote travel, or if people need to use it under that close contact definition. So we have a steady supply. There's more coming through, so people shouldn't be panicked about those rat tests.
Are you hearing that people are getting them for free and then selling them?
I haven't heard that, and that would be incredibly disappointing if that was the case. We have a government resource that we're following the health advice we're providing to Territorians, and that would be a matter that would be investigated. It's not appropriate.
Do you know if the people hospitalised are vaccinated?
I don't have that breakdown. We did provide some detail from the Deputy Acting Chief Health Officer yesterday, but I don't have anything more. Thank you.